Assalamu alaikum wa rahmatullahi wa barakatuh. Hi everybody. Today our lecture speak about the medule, head and neck, and we'll speak about the skull. So our objectives for today will be identify the skeleton of the head, describe the function of the skull, identify the bones of the cranium and the face region, identify the foramina of the skull and their structures, differentiate the skull of different species, describe the paranasal sinuses, and finally list the parts of the hyoid apparatus. So just for your information, this is for we'll start to speak about the skull of canine, about the dog, and then we will have a separate lecture about the large animal. So now in this photo is to know that there's different breeds of the dogs, and the skull will be different. We have like different breed of the dog. Could be like short skull or long skull, or brachycephalic dogs would be like short skull. This is for your information to know that is dogs has different dogs have different skulls. So a skull axial skeleton, as you know, axial skeleton includes the skeleton of the head, thorax, and vertebral column. So the skeleton of the head will be consists of the skull, which has facial part and neural part, and then the mandible, and then hyoid apparatus, and then the ossicles of the middle ear and cartilage of the external ear, nose, and larynx. As you know from the general arthrology, skull bones connected by sutures, which will be fibrous in the young animals, will be ossified in adult, right? And between the skull and the mandible and the hyoid apparatus is articular joint to allow movement. The function of the skull including protection of the brain and also support sense organs such the hearing and equilibrium and smell and vision, and also for pituitary gland, and also will be the passage for the entry of the respiratory and digestive system. So this is a skull of a dog and connected by the hyoid apparatus to the larynx. So now you can see how the connection, you can see the busy hyoid, and then you can see the thyrohyoid, right? You can see stylohyoid also, right? And also we have the keratohyoid, right? So this one right here, and then also we have the epihyoid here, and you can see the articulation here between the skull and the hyoid apparatus, and also a connection between the larynx and the hyoid apparatus. And as you know, this is apparatus important for deglutition, especially for involuntary process of swallowing. For your information, that is in case of the dog, there is no lingual process. So will be absent in case of the dogs. There is no connection between the hyoid apparatus and the tongue in case of the dog. So as we mentioned, a skull has facial part and the cranial part. Facial part, which include the facial bones, which have oral region, nasal region, and orbital region, right? So it's important to form the boundaries of the nasal cavity and also of the oral cavity. Some of the bones of the facial part of the skull are paired bones. The other will be single or unpaired bones. Example for the paired bones such as nasal bone, lacrimal bone, zygomatic, incisive, palatine bone, all be paired facial bones. Single bone like vomer bone and also hyoid apparatus is also single bones. Cranial part of the skull, which include the brain, right, or forming the brain case, neurocranium, also has paired bones and also single bone. Paired bones such as frontal, temporal, parietal, and pterygoid bone, and for unpaired bone such as interparietal bone, occipital, sphenoid, and ethmoid bone, right? So frontal and ethmoid bone and sphenoid bone important to form the boundaries for nasal cavity and bony orbit. So the roof or calvaria of the cranial cavity, including parietal bone, interparietal bone, and the frontal, the lateral boundaries of the cranial cavity formed by the temporal bones, as you know from the both sides, and the floor of the cranium will be formed by the presphenoid and the bisphenoid, which is known as sphenoidal complex, and also the basilar part of the occipital bone, which is known as basioccipital. The caudal part of the cranial cavity formed by the occipital bone, and the rostral part formed by the ethmoid bone. So if you look at this one is a skull of the dog, so you can see now we have the incisive bone, we have nasal bone, the maxilla bone, and lacrimal bone, frontal, parietal, interparietal bone, occipital bone, temporal, sphenoid, pterygoid, the palatine bone, and we have zygomatic bone. And you can see this one is a zygomatic arch, which formed by the temporal process of zygomatic bone and the zygomatic process of the temporal bone. And this arch is very important, because as you know, the masseter muscle attached here in the zygomatic arch, which give powerful action, for the biting in case of the canine. So now if you look also dorsal view, you can see again the same as we mentioned, right? You can see now the difference between the pair bone, like nasal bone, here is a pair, and they have the maxilla bone and the two sides, frontal bone, right? Parietal also will be like a pair bone. If you look at the ventral aspect, right, ventral view, you will see here the incisive bone, the maxilla bone, you have the palatine bone, the vomer bone, pterygoid, temporal bone, occipital, and sphenoid bone, and this would be the basioccipital. Right. So zygomatic arch, as I mentioned, is formed by zygomatic process of the temporal bone and the temporal process of the zygomatic bone, and this is very important because muscle of mastication, such as masseter muscle, will attach here and to give the biting adherence. Also, as you know, in the case of the dog, right, there is no the orbit will be incomplete, right? So if you go back here, you can see now the orbit, right, will be incomplete here, right, and only a ligament known as orbital ligament, which attach between zygomatic bone, has two processes. This one called temporal process of the zygomatic, and also has frontal process of the zygomatic, and the frontal bone has zygomatic process of the frontal. So the orbital ligament attached between the zygomatic process of the frontal bone and the frontal process of zygomatic bone, right? And this is very important because, as you know, the dog usually open the mouth widely, so there's no limitation here because there's no bony, and only would be the ligament attached here, right? Also, you can know you have a vomer bone is important because to form the septum nasi, and the caudal nerve known as choana, right, which lead to from the nasal cavity into nasopharynx. And then we will have also fossa of lacrimal sac. So now the skull of the dog again, and this is nice one to know. You will find I put a lot of pictures here, which will help you to revise, many times about the skull, right, of the small, of the canine. So you can see also incisive, nasal. You'll find nice diagram here. You can read it slowly and try to practice, memorize the different parts of the skull, right? Also, this is one as a lateral view, right? You can see here the fossa of the lacrimal sac right here, and you can see also here, is the external acoustic meatus. You can see also the two process of the zygomatic arch. This one would be the temporal process of the zygomatic bone, and this will be the frontal process of the zygomatic bone. And here you can see the zygomatic process, right, of the frontal bone, and here would be the orbital ligament, right? So also this skull showing you the attachment, all right? You can see now the attachment between the skull and the mandible, and you can see right here, this one would be the the condylar process, and will make what is called TMJ, temporomandibular joint, will be discussed later. And also you can see here the attachment here, right, to the hyoid apparatus. Now caudal view of the skull, so of the dog. So you can see now the two occipital condyle and the two paracondylar or jugular processes. You can see foramen magnum here. Also, you will be able to see the external occipital protuberance, the knuckle crest, right here also in case of the of the dog. This one also is important to show you the different here. Some of the foramina we'll discuss later also about the infraorbital foramen is very important, and also we have the mental foramina in case of the dog, different from large animal because dog has more than one mental foramen, and is very important for the exit of the inferior alveolar nerve as as mental nerve. And also here is the infraorbital foramen, is the exit of the infraorbital canal for the infraorbital nerve. And this is nerves here. This is foramina, which is the infraorbital foramen, and the mental foramina important for a nerve block in case of the removal of the teeth. From the upper one, you use the the maxillary or infraorbital nerve block, and for the mandibular teeth you're using the mandibular nerve block or the mental nerve block, and this will be discussed in the applied anatomy. Now ventral view to see also the incisive bone, and don't confuse yourself between number 2 and number 3. Number 2 is the palatine process of the maxilla. However, number 3 will be the palatine bone, right? You can see also the vomer bone here. You can see also here the presphenoid and the bisphenoid, and also the basilar part of the occipital condyle, right? You can see also tympanic polla, and also you can see here is the temporal process of the you can see the zygomatic process of the temporal bone right here. Zygomatic process of the temporal bone. Here we have the zygomatic process of the this one will be zygomatic process of the temporal. This will be temporal process of the of the zygomatic. Also again another one to see also here the two foramina, which we have the greater palatine foramen and the lesser palatine foramen, and you will know later on that is the caudal palatine foramen with the greater palatine foramen will make palatine canal for the greater palatine artery. Now, if we speak about the cavities of the skull, we have cranial cavity, right, for the brain. We have nasal cavity, right? We have paranasal sinus, and then we have tympanic cavity. So now you remove the roof here of the cranial cavity, and you can see here, of course, you can see now here the cribriform plate, which is important for the passage of the first cranial nerve, which is the olfactory nerve. And here you can see also this one will be the fossa for the pituitary gland, right? Hypophyseal fossa. And you can see also we have the optic canal, and then you have here orbital fissure. You will discuss later the structure which passing through this foramina. And then we have, right, so this one will be the hypophyseal fossa, you can see right here. And then we have the oval foramen. Here, foramen rotundum. Just for your intention, foramen rotundum or round foramen only can be seen within the skull, not outside the skull, only within the skull. And this, foramen is important for the passage of the maxillary, nerve, which is a branch of the trigeminal nerve, which is number 5. Nasal cavity, as you know, nasal cavity, we have nasal concha. You can see nasal conchi or concha or nasal concha is not a problem. And, nasal myitis. Nasal septum separates, right? Nasal septum is, divided the nasal cavity into two halves. And then you have, formed by frontal bone and maxillary bone laterally. And we have, in case of the dog, we have dorsal nasal concha, middle nasal concha, and ventral nasal concha, and we have ethmoidal larynx or ethmoidal conchae. Nasal meatus, we have dorsal nasal meatus, we have middle nasal meatus, we have ventral nasal meatus, and we have common nasal meatus. So now if you look at this here, right, you can see now, this is the nasal concha right here, and you can see we have dorsal nasal meatus, we have ventral nasal meatus, and then we have, nasal septum, and, also we'll have the common nasal meatuses. Right, if you look at here, you will see the vomer bone, which is, vomer bone divides the cavity into, two halves. And you can see right here is the, dorsal nasal turbinate. The difference between turbinate, don't confuse between turbinate and concha. Turbinate bone is the bone itself. When the turbinate bone is covered by respiratory mucous membrane, it became concha or concha, right? So you can see right here is a dorsal nasal, dorsal nasal turbinate, because it is only bone not covered by mucous membrane, so I can name it as a dorsal nasal turbinate. And then you have ventral nasal turbinate right here, and you can see also we have dorsal nasal meatus here, right? And you can see we have ventral nasal meatus, and then we have common nasal meatus, and you can see here the vomer bone, which divided the nasal cavity into two halves. So if just to go back again to we mentioned about the lacrimal canal, and we'll see that later also, and the palatine fissure and tympanic cavity for the middle ear, and this is why we have the connection between the nasopharynx and the auditory tube through the pharyngeal opening of the auditory tube, and external acoustic meatus usually closed by tympanic membrane. So again, if you look at here, cross section in the skull, cranial skull, you can see now here cranial cavity, and you have nasal cavity, the nasal bone, and then you have dorsal nasal concha, right? You have the endoturbinates bone, which form the ethmoid concha. You can see the vomer bone right here, right? Also you can see here the ethmoid bone, right? And you can see this perpendicular part of the ethmoid bone, and cribriform blade is important for the passing of the olfactory nerve bundles. Paranasal sinus is important. It is a filled cavities between the internal and external lamina of the bones of the skull. It is present in certain bones such as frontal bone and maxillary bone, and is important to lessen the weight of the skull, also to give areas for muscular attachment, for air conditions, right? And also for teeth, for example, maxillary bone maxillary bone and the sinus important for the roots of the cheek teeth, especially the last 3 or 4 molar teeth. Paranasal sinuses, actually the number and the size also differ according to species. So in case of the dog, we have frontal sinus, so there's a main one. So the main one in the dog is the frontal sinus, and a maxillary sinus in the dog is very small, and this is why we name it as maxillary recess, right? And we'll discuss this one important in applied anatomy to know how this is important, especially if you can sometimes you can find abscess, drainage below the eye of the dogs. Then we'll discuss that importance in the applied anatomy. Mandible, or the lower or lower jaw bone. If you can just go here, you will find there's a mandible right here. So you can see the mandible of the dog, right? We have the body, right? And this would be intermandibular joint. Remember what is interesting, that is the intermandibular joint will be not completely ossified in case of the dog, and also in case of the bovine, because important for for food and for feeding, especially the dog try to move slight movement in the joint, and also in case of the cattle. However, in case of the pig and in case of the horse will be completely ossified. Right, now you can see here is 2 processes. We have the coronoid process, And also we have the condylar. This one is important for forming the TMJ, the temporomandibular joint, which is synovial joint, right, with the mandibular fossa and the skull. The two processes present in all animals. However, in case of the dog, we have additional one here known as, known as the angular process. Also, you can see the body of the mandible here. You can see ramus of the mandible here, and you can see also masseteric fossa was important to attachment of the masseter muscle. Right? Also, you can see we have here, this will be discussed in the teeth about, the different types of teeth, about the incisor, canine, and also premolar and molar teeth. This one also, in case you can see now the mental foramina in case of the dog, and you see the different processes, and also you can see the ramus of the mandible, body of the mandible. Right? This also too in case of the dog, to see the mental foramina and different processes. So we speak about the temporomandibular joint. This is between the condylar process of the mandible and the mandibular fossa, of the bones, of the skull. This is a synovial joint, right? And it has ligament, like lateral ligament, between the retroarticular process and the coronary process. And the caudal ligament is not present in carnivorous and the pig, but present in other animal. And as I mentioned, intermandibular joint or mandibular symphysis will be incomplete in case of the cattle and in case of the dog. However, will be completely ossified or known as synostosis in case of the pig and the horse, and this will be related to the food, the feed of the animal, or how the animal, the behavior of of eating in animals. Now you can see closely here the TMJ here, right, between the mandibular fossa right here and the condylar process. You can see here the TMJ, and this is very important, especially in the horse, to know the landmark, to know how we can take the synovial fluid from this joint. Also, you can see the different part of the hyoid apparatus. So what is the foramina and the canals of the skull and the mandible? Now you can see here, all right, so you can see now the maxillary foramen, you can see the sphenopalatine foramen, you can see the caudal palatine foramen, and you can see also the ethmoidal foramina. In case of the dog, we have two foramina. However, in large animal, we'll have only one foramen, ethmoidal foramen. This we have ethmoidal foramina, and then we have the optic canal, orbital fissure, and then we have rostral alar and the caudal alar. The rostral alar and the caudal alar here will form what is called alar canal, which is important for passing of the maxillary artery and also for the exit of maxillary nerve. You can see also the external acoustic meatus right here. You can see also the paracondylar process. Again here, if you open inside, right, so you can see now also the ethmoidal, as I mentioned, the cribriform plate, and then we have the optic, orbital, round. This foramen is only can be seen within the skull, not outside the skull. And then we have oval foramen for the mandibular nerve. Again, you can see the orbital, rostral alar, caudal alar canal, and then we have oval foramen for the mandibular nerve. We have a foramen lacerum here, as like in case a little different between the dog and the equine. And then we have retroarticular foramen, we have hypoglossal canal, and we have tympano-occipital fissure. Tympano-occipital fissure is like a jugular, but this foramen will be outside as a tympano-occipital fissure. Inside the skull will be as a jugular foramen. Again, now to see the different foramina, as we mentioned, ethmoidal, optic, orbital, right? And this is known as fossa of the pterygopalatine fossa. So ethmoidal, optic, orbital, and rostral alar, caudal alar were known as foramina of the pterygopalatine fossa. And then we have the we have maxillary foramen, we have a sphenopalatine foramen, and then we have the caudal palatine foramen. This is more close also to see the different foramina. Again, I'm just repeating many slides, so which is to know to practice and to be able to see the foramen very clearly. Again, you can see also different type, and we have tympano-occipital fissure, we have oval foramen, and then you can see the alar canal here. And you can see also here the major palatine foramen, and also you can see here the rostral palatine foramen. Now this table is important. The table is important to know the structure, to know the name of the foramen, and then the structure. For example, now foramen magnum for the spinal cord, optic canal for the optic nerve, round foramen rotundum for maxillary branch of trigeminal, oval for mandibular, internal acoustic meatus for facial and vesicular, jugular. This is one interesting because this is only unique in case of the dog. Because as you know, in the equine, internal carotid artery will come out from the foramen caroticum of the foramen lacerum. However, in case of the dog, the internal carotid artery will come out from the jugular foramen. See, this was exception and something unique in case of the dog, right? So again, you have to read this table carefully. For example, caudal palatine foramen will, for important for greater palatine artery, for example, infraorbital foramen for the infraorbital nerve, maxillary foramen for maxillary artery and nerve, right? Carotid canal for the internal carotid artery, except in the dog, as we mentioned, because it comes out from the jugular foramen. So now this table also to show you the difference between the canine and the other large animal. For example, interparietal bone will be like in cat and will be ossified in other animal. Orbital rim, as we mentioned, only dog has orbital ligament. That, however, in the equine and also in bovine, you will find the orbit is complete, but in case of the canine will be the incomplete. Also, facial crest is present in the skull of the equine, not right, and also will be very prominent in the ox, very prominent in the horse. In ox, we have facial tubercle, right? Less distinct in case of the dog. As you know, there is no alveolus in case of the ruminant, and also have only dental pad. What is the most important structure? That round foramen and orbital foramen joining together to form what's called orbitorotundum. So foramen orbitorotundum only present in the large ruminant, small ruminant, and also in case of the pig. As we mentioned, also the half of the mandible will be completely ossified in case of the equine and pig, however, will be incomplete in case of the dog and also bovine. Also, you can see the tympanic bulla is prominent in ox, pig, and cat. Also, ox has no alar canal. Alar canal present like in equine and present in the dog, but absent in case of the ox. Hyoid apparatus is, if you look at this one, this hyoid apparatus, right, in case of the dog. So you can see now, if you look at this one, you can see we have the main one is the basihyoid. Basihyoid has this part here is known as kerato. You can see serato or kerato. Keratohyoid here, and then we have the epihyoid, and then we have, after epihyoid, we have a stylohyoid here. This is one to attachment for the skull. And then we have this number 5, thyrohyoid, to attach to the thyroid cartilage. And you can see here there is no lingual process. Like, for example, in case of the equine, we have additional process known as lingual process, will come out from the basihyoid to the tongue and also be long. In case of the bovine, also it is present, but will be shorter than that of the horse. Just now to see, some layers. Also, you can see some, about the zygomatic arch of this, to know, and also to see the pharynx, larynx, and the epiglottis. Also, is for your information to see the, the zygomatic arch, the ear canal, the maxilla. The same also here to see some photos, important, interesting structure. Also, his X-ray to know the different part, of the of the skull. We have like a nasal bone, we have like the hard palate here, and then we have the occipital bone. That's for for your information to know how the skull of the dog will be look like here. Also, this one will be ventral view to see the skull and the vomer bone here. You can see the hard palate here. You can see also this is the hard palate. You can see the incisor. You can see the zygomatic arch. This is for your information for now until you study radiograph in the in the clinic years. This also for your information to know the cat. If you study the cat, that's fine. If you don't, we mentioned already the difference between cats and dog. You can see that if you want to see. this in case skull of the cat. Some universities study cats, some doesn't. So as according if you have to study the cat or no. And also here the cross section in case of the cat, and also this is the mandible in case of the cat. So thanks so much. I hope you understand, and please feel free to contact me if you have any question, and see you later. Assalamu alaikum wa rahmatullahi wa barakatuh.